He's amazing. He is the strongest little boy you have ever seen. He's big. If you were just looking at him, you'd never know anything was wrong.
Andrea and Heath Sexton never imagined that would even be possible for their son Ryals after he was diagnosed with a congenital heart defect while still in the womb.
All of a sudden, to see the ultrasound tech blinking and staring at the monitor and then getting a little frantic and rushing out to get the doctor, I knew something was wrong.
The diagnosis? Hypoplastic Left Heart Syndrome, or HLHS. Essentially, there was no left side of baby Ryals' heart. It's a relatively rare condition. Only about 1,000 children are born with HLHS each year in the United States.
Basically, I guess, coming home from the hospital, we were wondering how is this going to change our lives. Obviously, the care of a child that possibly would need a lot of help, maybe a lot of long-term help. And then, of course, in the back of your mind, obviously you've read that a lot of children don't make it past 3 months. And so just thinking about, am I going to be prepared for a funeral?
The Sextons packed up and temporarily left their home in Alabama to move to Philadelphia. The plan was to place Ryals' hopes of survival in the hands of a team of doctors at CHOP, Children's Hospital of Philadelphia, one of the leading medical centers for HLHS surgeries and treatment. There they met Dr. Joe Rosano, who heads up the cardiac center at CHOP.
Yeah, they're very, very complicated surgery. Prior to the 1980s and 90s, there were essentially no good surgical options for these patients. But a number of very innovative surgical techniques were developed that have allowed many of these children to survive and thrive.
There is nothing natural about handing your child over to a surgeon, but I know that we're in great hands. I know that this is his chance at life, and so it's something we've got to do.
This series of 3 surgeries allows children with HLHS to live relatively normal lives, but it isn't perfect. Having the right side of the heart perform the tasks normally handled by both sides of the heart puts tremendous stress and pressure on the right side. As patients with HLHS are aging, doctors are realizing many of their hearts are unable to continue to function on their own, and some patients need a heart transplant. But Andrea found out about a clinical trial going on at Mayo Clinic aiming to solve that problem.
Quickly, they set me up with an interview over the phone with Dr. Nelson. He was amazing. He gave me hope.
The HLHS program has a mission to recreate the right ventricle to make it bigger and stronger. So we're finding ways of inventing new therapies to make that right heart stronger by stimulating growth of the heart muscle and make the 5 horsepower engine a 10 horsepower engine, a 50 horsepower engine. And if we make it strong enough, we believe that that has a shot at delaying and preventing transplant for a significant number of these children.
The key to this groundbreaking regenerative therapy trial is stem cells, but not just any stem cells. Dr. Tim Nelson and his team found a way to use the baby's own cells.
So the first product that we're testing in our clinical trial is using umbilical cord blood from the baby's own body. So the child has to be diagnosed in utero, and we have to be able to collect the cord blood at birth. We can collect the cord blood from anywhere in the country and ship it into Rochester, Minnesota to have it processed to have a high concentrated product that gets frozen in low temperatures of liquid nitrogen. That product is frozen for 3 months until the child has their second surgery, or the Glenn operation, which then we can bring those cells back into the operating room, thaw them, and deliver them directly into the heart muscle. The hope of this is that it causes a fertilizer type of an effect where these cells are able to fertilize the right ventricle muscle and allow it to grow bigger and stronger because it's received this cell-based therapy.
On Thursday, May 4th, 2017, Ryals Sexton became the 5th clinical trial patient in Mayo Clinic's HLHS team's research. While surgeons at CHOP performed Ryals' Glenn operation, they injected stem cells from Ryals' umbilical cord blood directly into his tiny heart.
5, 4, 3, 2, 1, out.
After several hours of waiting during Ryals' surgery, his parents are emotional and relieved to hear all went well and that Ryals' cells were injected without any problems.
Felt like we had a superhero coming in on a jet plane, and he had this box of super cells, and it felt like you were coming to save my son, but I realize it's just a study, but we have high hopes, and hopefully everything will work out well.
Well, it's not me. We have
team of 60 people. You give me too much credit. There's 60 people behind this that are working on this.
Hours later, Dr. Nelson and the team members who made the trip with him are back on the Mayo 1 fixed-wing plane heading back to Rochester to move on to the next child, the next step in their research.
That motivates us to go back into the lab. It motivates us to do other experiments in the laboratory to give some new hope and bring new transformative therapies is really what motivates the entire team every day.
The HLHS team's ability to do its research, conduct clinical trials, fly across the country to personally deliver cells to Ryals in Philadelphia, and most importantly, to give hope to all the families dealing with HLHS is only possible because of one family. Todd Wanek runs the largest furniture retailer in America, Ashley Furniture. He and his wife donated tremendous funds and resources to launch the Todd and Karen Wanek family program for Hypoplastic Left Heart Syndrome.
So almost 23 years ago now, our daughter was diagnosed with HLHS.
The Waneks ended up at Mayo Clinic, hoping doctors here could save their child. And for close to 23 years now, they've been on a mission to use their resources to help find a cure for HLHS.
This research is important to me because it affects my family. It affects my life. And my goal is to have my daughter live a long and healthy life, as well as every single child that's affected with this disease.
With all of Wanek's resources behind them, the HLHS team built a top-notch infrastructure for their research and looked for a way to bring the research to all patients with HLHS, no matter their location. So in 2017, the HLHS team began creating a Hypoplastic Left Heart Syndrome research consortium.
So we've built this infrastructure to be able to do clinical trials, and ultimately we need to be able to have a large number of families participating in that. So the consortium really represents our ability to take this science and technology and teams of people to other centers of excellence that allows us to interact with more families at more locations.
CHOP joined Mayo Clinic as the first members of the consortium, and Ryals was the first patient to benefit from it. Not long after, Children's Hospital of Los Angeles became the third institution to join the consortium, followed soon after by Children's Minnesota. It's a unique approach that Dr. Nelson's team at Mayo is uniquely positioned to pull off because of the resources and infrastructure they have at their fingertips.
Logistics are a challenge in this case, to be able to get cord blood collected, and then once it's processed, to get the cord blood back to the centers. And in this case, we were able to use Mayo 1 fixed-wing aircraft to actually fly the product out almost like an organ transplant.
With the groundswell of support growing, the HLHS research team's focus on finding a cure never falters.
The research that we're working on today is likely going to lead us to many things that we can't even envision today. However, we do believe that the regenerative strategies that we're working on today will allow us to rebuild the heart and make it stronger. You can even imagine where the technology is leading us to be able to recreate patches and constructs and maybe even whole ventricles that can be engineered, that can be transplanted at some point.
The days after Ryals received his cells were filled with firsts for the Sextons. A first smile and a first bottle. They got to bring Ryals back home to Alabama as a growing, relatively healthy baby boy, and they've finally gotten what they feared they never would. A sense of normalcy, and a chance to dream about Ryals' future.
I guess I see the survivors of today that are having children and having careers, and that's what I see my son as. And the hope is that he can see his grandchildren.
I see kindergarten graduation. I see middle school, Ryals Sexton come up for your award. I see college. I see happiness, and I see my boys playing together. I see a happy family, and I believe that this work, this research that these doctors have put hard work into is going to let us achieve that.